Assalamu alaikum. I am Dr. Syeda Farzana Yesmin, Associate Professor Gynae Obst at the Akij Medical College, Khulna. Today I will discuss on some written questions. First of all, we will discuss about the questions about dysfunctional uterine bleeding. What is dysfunctional uterine bleeding? What are the causes of dysfunctional uterine bleeding? What is metropathica hemorrhagica? What is the difference between threatened abortion and metropathia hemorrhagica? First of all, we should know what is dysfunctional uterine bleeding. It is a state of abnormal uterine bleeding without any clinically detectable organic, systemic or iatrogenic cause. For Viva questions, we should know what are the organic cause, what are the systemic causes and what are the iatrogenic causes which may produce menorrhagia, and these conditions are not included in dysfunctional uterine bleeding. What are these causes which are responsible for menorrhagia but not for dysfunctional uterine bleeding? And these causes, among the organic causes includes fibroid adenomyosis, pelvic endometriosis. Systemic causes includes liver dysfunction, hematological causes, severe hypertension, congestive cardiac failure, endocrinopathy, which includes hypo or hyperthyroidism, and iatrogenic causes includes combined oral contraceptives, injectable contraceptives, intrauterine contraceptive devices. These conditions are not included in case of dysfunctional uterine bleeding. When any of these causes are found in menorrhagia as a cause of menorrhagia, this is not dysfunctional uterine bleeding. When bleeding occurs but cause is not found, any organic, functional, systemic or iatrogenic cause is not detected, then it is dysfunctional uterine bleeding. What are the types of dysfunctional uterine bleeding? Types. There are two types of dysfunctional uterine bleeding. First of all, anovulatory dysfunctional uterine bleeding, which includes 80%. Anovulatory dysfunctional uterine bleeding. This anovulatory dysfunctional uterine bleeding includes threshold bleeding or puberty menorrhagia, metropathia hemorrhagica, premenopausal dysfunctional uterine bleeding. And second, ovulatory cause. Anovulatory cause is responsible for 80% dysfunctional uterine bleeding, 20% ovulatory cause. Ovulatory cause includes polymenorrhea, polymenorrhagia, oligomenorrhea and functional menorrhagia. Polymenorrhea, polymenorrhagia, oligomenorrhea, functional menorrhagia. Functional menorrhagia may be due to irregular ripening of the endometrium or irregular shedding of the endometrium. Functional menorrhagia includes irregular ripening of the endometrium, irregular shedding of the endometrium. Now, what is metropathia hemorrhagica? It is an anovulatory dysfunctional uterine bleeding which is characterized by short period of amenorrhea followed by acyclical, prolonged, painless bleeding. Short period of amenorrhea is for 6 to 8 weeks, and this acyclical prolonged bleeding may be extended to 2 to 8 weeks. Acyclical, painless, prolonged bleeding may stay for 2 to 8 weeks and short period of amenorrhea for 6 to 6 to 8 weeks. Now, what is the difference between metropathia hemorrhagica and threatened abortion? First of all, we should define what is metropathia hemorrhagica and what is threatened abortion. What is metropathia hemorrhagica? We have already heard the definition of metropathia hemorrhagica. It is an anovulatory type of dysfunctional uterine bleeding which is characterized by short period of amenorrhea followed by acyclical prolonged painless bleeding. And what is threatened abortion? It is a clinical entity where the process of abortion has started but has not progressed to a state from which recovery is impossible. It is a clinical entity where the process of abortion has started but has not progressed to a state from where recovery is impossible. So, we first define metropathia hemorrhagica and threatened abortion. Now, in case of threatened abortion, patient shows signs symptoms of pregnancy. Patient shows signs symptoms of pregnancy, but dysfunctional uterine bleeding, such type of signs symptoms are absent, which includes nausea, anorexia, vomiting. In case of pregnancy test is positive in threatened abortion but negative in metropathia hemorrhagica. The character or nature of PV bleeding, in case of threatened abortion, it is scanty, usually scanty and for short time, but in case of metropathia hemorrhagica, the bleeding is heavy and prolonged. Bleeding is heavy and prolonged. Even patient may present with hypovolemic shock in case of metropathia hemorrhagica. Patient may present with hypovolemic shock, but this such type of hypovolemic shock usually absent in threatened abortion. And cystic ovary may be present in case of metropathia hemorrhagica, but such type of cystic ovary usually absent in threatened abortion. In case of prognosis, threatened abortion, in case of prognosis, the metropathia hemorrhagica may become life threatening condition, may life threaten, but threatened abortion is not life threatening. Prognosis is good in case of threatened abortion. So, we should know the difference between metropathica hemorrhagica and threatened abortion. In next class, we will discuss about what is secondary infertility, what are the cause of tubal block, who are the candidates for IVF ET. So, Allah Hafiz, Assalamu alaikum, thanks to all.